Today, we are tackling advanced maternal age. I was of advanced maternal age when I was pregnant, had my son at 38, and I was getting all these extra tests and all this kind of stuff, and it left me with a lot of questions. So today's doctor specializes in high-risk pregnancies, which includes advanced maternal age. So I cannot wait to talk to him. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? What can we learn from our poop? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. To discuss advanced maternal age, I'm talking today with Dr. Bassam Rimawi. He is a board-certified OBGYN with WakeMed. Welcome.
Thank you so much. Thank you for having me today.
Yeah, and you mentioned you are a specialist in high-risk pregnancies, and advanced maternal age is one of those.
Yes, absolutely. That's something that I did my fellowship training in after I finished my residency in obstetrics and gynecology. So that's something that I see a lot in my practice.
Well, I would have come to you because I was 38 when I had my son, and apparently that's considered advanced maternal age. What is what's the criteria?
Yeah. So, the age of 35 or older was selected as the age for advanced maternal age. And just to kind of familiarize everybody with terms, the word maternal means mom and paternal means father. So advanced maternal age is when the mom is above 35. And where did they get the age 35? What's so unique about 35?
Yeah, you marked the next question off.
There's nothing magic about 35.
Okay.
Nothing magically happens after 35. But the way they got the age of 35 is, many years ago when mothers came and they wanted to do genetic testing, the only one way to do genetic testing, and this is many years ago, was to do a procedure called an amniocentesis, where they put a needle into the mom's belly and get a little bit of water from around the baby, and then they pull the needle out. And at that time, the risk of like a miscarriage was about 1 in 350.
That's a lot.
Yeah, that's a big number. Nowadays, it's more like 1 in 1,000.
That's I like those odds better.
Yeah, they got a lot better now. So the age of having a baby, say for example, with Down syndrome at 35 is about 1 in 350. So since 35 is about 1 in 350, and at that time, the risk of a miscarriage was about 1 in 350, they kind of just clinched the two together and they said, why don't we just make 35 as this advanced maternal age?
Because there's slighter, higher risks in those two areas.
Correct.
Gotcha.
Correct.
Okay.
But really, the risks really occur when they get closer to like 40s and higher.
Tell everyone what it used to be called, because my gynecologist told me that I was this, and it's not a nice thing to hear when you're having a baby.
Yes. And we used to call it a geriatric or an elderly pregnant woman back then.
An elderly pregnant? I was 38.
Yes.
Sorry, I'm yelling at you, but really I'm yelling at him.
Correct. So obviously that got a lot of negative feedback.
Yeah.
There was a lot of upset patients with that diagnosis in the chart. So that term kind of got put to rest, and advanced maternal age was used in its replacement. And that's a lot more friendlier and less derogatory to tell a mom that you're just above 35 and nothing magic about that.
Yeah. What are some of the complications that are associated with being an older mother? Yeah,
so when I get moms that are 35 and older and they ask me what are some of the complications, when we talk about complications, some of these risks can be for the mom and for the baby. For the mom, they can get like certain high blood pressure conditions. There's a condition called preeclampsia where they get high blood pressure. They might get a little bit of excess swelling in their legs because they're losing protein in their urine. Sometimes they might have some organ involvement, like their liver, their kidneys may get involved and get affected. So we call that HELP syndrome, for example, where they start to affect those organs and stuff. They're at higher risk to get something called gestational diabetes. They're at slightly higher risk to get like a cesarean section, which we can talk about here in just a moment. And for after delivery, there might be at slightly higher risk to have a little bit of excess, more bleeding from the uterus, what we call postpartum hemorrhage.
Oh, I think that happened to me.
Yeah. And from a baby standpoint, sometimes they're at slightly higher risk for like stillbirths, miscarriages, low birth weight or something called fetal growth restriction, prematurity. And those are sometimes some of the small risks. But whenever I talk to moms, I always emphasize to them, it doesn't necessarily mean that you will get these risks.
Okay.
So you are a slightly higher chance, but it doesn't mean that they will get it.
It's normal nowadays, I feel, with the economy like it is, and just with the fact that we don't want to just be moms. I mean, it's perfectly fine if you want to be a mom.
Yeah.
But, we have other parts of our lives that we want to get to a certain point before we decide to have a baby.
Correct.
And it's just, it makes you panic hearing stuff like this.
It is scary. And that's why we try to relieve a lot of the misconceptions that because you're 35, that means you are for sure going to have a bad outcome for your pregnancy. And that is not always the case. We do have quite a few number of moms that are in their 40s or higher, that many of them will do just fine in pregnancy. And when I first became an obstetrician gynecologist back in the 2007, 2008 range, I would see maybe 1 out of every 15 women that were 35 and older. And nowadays we're seeing maybe 10 out of every 20 that are 35 or higher. So that number has increased. And the reason for that is because, women are now getting more jobs compared to back then. They're finding later relationships with other people. They want to have another family. Maybe they tied their tubes at one point when they were young, and now they met a new person in their life and they want to have another child. So they go back to the doctor to reverse the tying of their tubes or come off of a birth control. So we're seeing a lot more women of 35 and older wanting to have some of these children at a later age of their life because now they feel ready. They feel accomplished in their life, and they can put some of their education to the side and focus more on a family-oriented type of environment. Yeah.
Let me ask you this. We're talking about maternal age. What about, is there an advanced paternal age?
Yeah. So as we said before, paternal refers to the father. And there hasn't been a one good universal number for advanced paternal age, but most of the studies will say above 35 to 40 for father as well. But really the risk of complications generally happens at a higher age, like 45 to 50.
And what can happen?
Yeah. So as we discussed before, some of those risks for the mom, for father's age, sometimes there is slightly higher risk for like psychological conditions like autism and schizophrenia. There can be certain genetic conditions like something called Marfan syndrome, neurofibromatosis, Cruzon syndrome, Apert syndrome, Pfeiffer syndrome. These are all like certain genetic conditions that can be seen in advanced paternal age. But again, it doesn't necessarily mean that that would happen.
No, of course not.
Sometimes that can happen at a much higher chance when you have a father of above 35 to 40 years of age.
Okay, and you mentioned that the risk, you said that whenever you get closer to 40 as a mom, that's a bit more for concern. Why is that?
Yeah, just because the quality of the egg changes. Whenever I teach my students or my residents, I always tell them that when a baby is destined to be a female very, very early as a fetus, as an embryo, they are basically born with all their eggs. They don't develop new eggs over the years of their life. Unlike men that will regenerate new sperm until they hit a certain age limit or some medical issue that might limit how much sperm production they may. Females are born with all their eggs, and as they age, they naturally lose some of those eggs. So if you're born with all your eggs, you can imagine at the age of 20, 35, 40, the quality and the age of the egg is obviously going to be higher. So the higher the age of the quality and the quality of the egg starts to break down easily, starts to increase the risk of miscarriages, starts to increase the risk of genetic conditions. Hence the reason why we see some of these conditions at a higher maternal age.
Interesting. Are there any long-term effects that can happen to the mom or a baby if you've had a baby later in life?
Generally, if the pregnancies are uncomplicated, you generally have little to no long-term effects. However, if that mother does develop diabetes of pregnancy or a high blood pressure of pregnancy, sometimes they can be a higher chance to develop like type 2 diabetes later in life if they've never had it. They can develop hypertension after pregnancy that requires them to be on long-term medication, and certain cardiovascular diseases. However, if they're uncomplicated, they generally do well. From a baby standpoint, again, if the pregnancy was relatively uncomplicated, these children do very well. However, if they were born very small in age, premature, had skeletal abnormalities or other structural abnormalities, had genetic conditions, then these children are more likely to have more long-term consequences because of those sequelae. But if they're generally normal, they usually do just fine long-term.
Oh, good. All right. Well, You mentioned C-sections. Do you find them more common in older moms?
Yeah, and the reason for that is because of those medical complications. If a mom develops diabetes or high blood pressure or prematurity, like where the baby is really small, sometimes that in itself will cause a mom to have to require a more expeditious, quicker delivery.
Okay.
And sometimes C-section or cesarean delivery would be the best route of delivery for them. But being of advanced maternal age, if it's an uncomplicated pregnancy, generally they do not require a C-section.
Oh, good. Okay.
So we don't tell all moms walking in, oh, because you're 40 years old, you're going to have a C-section because of your age.
Yeah.
We don't recommend that. We just tell them there are slightly higher chances if they develop complication. Thereby, it's like a domino effect. Now might be a higher chances of getting a C-section because of that domino effect.
Got it. Will you elaborate on the extra testing that goes on with a mom that's over 35?
Yeah. So at WakeMed, we have a very big team of maternal fetal medicine specialists like myself, and we have great number of genetic counselors. So when moms are above the age of 35, and anybody can meet with our genetic counselor, but generally once they're above the age of 35, we strongly encourage them to sit down with our genetic counselor. And the discussion that they have is basically the higher chance of having a baby, for example, with Down syndrome or other genetic conditions like something called trisomy 18 or trisomy 13. And those type of conditions tend to get higher with the higher maternal age. And if it's a advanced paternal age, then they talk about some of those specific genetic conditions that can happen in that case. They'll talk about the different types of genetic tests that are available. I mentioned a few minutes ago the amniocentesis, which is that needle test. Nowadays, we've advanced in medicine, and now we have a lot of blood tests that have very high accuracy rates for looking for babies with like Down syndrome, for example, and other genetic conditions where moms don't necessarily have to do the amniocentesis if they don't want to.
Right. Okay. Are there any benefits to having a baby when you're older?
There are some studies that have found that longevity increases, meaning the life expectancy increases. There was a study
of the mom or the baby?
Of the mom.
Ah.
Yeah. So there was a study that was actually published a few years ago that looked at women that were at the age of 33 that had their last baby were more likely to be in the top 5 percentile for living up to 95 years of age. And if they had their last baby at the age of 40, they were more likely to live up to 100 years of age.
So I'm going to live a long time.
There you go. Yeah, there you go. So having a baby later in life as your last baby doesn't necessarily mean that they will have a premature death in their life or things of that nature. It's the other way around. And the reason for that is because we think that having a baby that age actually has some slowing of aging process benefits to it. So it helps to kind of prolong life.
Interesting.
Now, keep in mind, these are in mothers that didn't have really a complicated pregnancy. If they had the diabetes, the preeclampsia, other cardiovascular disease, that in itself can affect the longevity of their life. But if it's relatively normal, they can live a very long life.
Oh, interesting.
Yeah.
I wonder if it's got anything to do with the fact that you've got like brand new cells happening and like there's such a symbiotic relationship that you kind of get a couple of those cells in you.
That's absolutely it. Yeah, new cells are being regenerated. Older cells are kind of being replaced and stuff. The age process is slowing down. So the combination of all of this helps these mothers to live longer.
I love it. Finally, something that I'm excited about when
Yeah, very good news.
Is there an age when that you recommend someone not have a child?
Yeah, so there's no good universal number to say you should not have any children after that. But for example, if I refer a patient to a fertility clinic for them to have like a procedure called in vitro fertilization, where they kind of take a baby from outside and they implant it inside, most of the studies have shown that by the time they get to their mid 40s to upper 40s, that probably should be the limit. Once they hit 50 and above, probably ethically is probably not advised to get pregnant. Not that they shouldn't. If they want to, they can. But the risk of complications starts to increase after that. So that's why I want to encourage moms, if they are in their 40s and they want to have a child, they should be able to have a child. They can come meet with one of us. We can talk to them. They can meet our genetic counselors. They can have what's called a preconception consultation where they come to us before they get pregnant. And we can kind of talk about all of this. They can see a fertility specialist. They'll run some blood tests on them and some ultrasound of their uterus just to make sure that everything looks great. And then we can help them to get pregnant.
Oh, good. Does it matter if your first pregnancy happened at an advanced maternal age, or but what if you're on your like fourth child?
Yeah.
So is there any difference?
Yeah, so studies have shown that the less children you have, so if this is like your first child, the risk of like preeclampsia or high blood pressure tends to be higher in those very first pregnant women, what we call premi-gravid patient, versus multi-gravid. They've had pregnancies in the past. They're less likely to have preeclampsia, especially if those pregnancies were uncomplicated. They're more likely to have a better outcome. So the complication tends to increase if they have their very first child at an older age. Yeah, a higher age.
Like their body was used to it, knows what to expect. Maybe that's part of it.
Correct. Oh. Exactly.
Has the perception and medical understanding of advanced maternal age changed over time?
There has, because back in the days, it was almost considered unethically incorrect for a mom of 35 or 40 to get pregnant. They just thought that, they're more destined to have complications and they're doing injustice to themselves and to their children. And that conception, that misconception has kind of been replaced and diminished and gone, because studies have shown that that's not necessarily true.
Yeah.
So now we encourage moms of those age that if they really want to have a child at that age, they should be able to try.
Well, as someone who's had a kid at 38, their first kid, and I'm grateful that it was totally uncomplicated. I think that where I am in life makes me a better mother. Were I to have him in my 20s, I was still learning life. As an older mom, I've got a lot of that basic stuff down pat, and I can really concentrate on him.
Yeah,
you know what I mean?
Absolutely, 100%. And you'll be able to live longer now.
Yeah, I know.
And
More
get to
time.
attend his wedding in the future, and his college graduation, and hopefully get to see his children too.
Oh my God, I hope. Okay, now we're on to listener questions, and I'm looking here, and you've already answered one of them, which was if you live longer if you have a baby at an older age, which is great news.
Absolutely.
Are multiples more common in older moms? I've always heard it's like your body is throwing a going out of business sale, tossing out 2 or 3 eggs at a time.
Yes, absolutely. So as we mentioned before, a female is born with all her eggs, and as they get closer to that advanced maternal age, their ovaries are more likely just to try to release as many eggs as possible.
Just get one of these fertilized, any of them. Yeah.
Exactly. And every egg should be destined to become fertilized. It doesn't mean that it'll be successful, but they should be destined to get fertilized. And the sperm, there's millions of sperm in a normal count.
Yeah.
So there should be enough sperm to fertilize those eggs.
Yeah.
So of advanced maternal age, it is certainly more common to have more eggs. And a lot of times those eggs are going to be like fraternal siblings, for example. One brother, one sister, or 2 brothers, 2 sisters that are of fraternal age, because it's separate eggs
that makes sense.
that aren't being produced.
Well, that makes, for any of you thinking about, I just want one more baby, keep that in mind. You could have 3 more babies. Just remember that.
Absolutely. And I've seen it many times in my practice.
I'm sure you have.
I had a couple yesterday in my office.
Oh, really? And they had how many babies?
They had 4 at home. They wanted 1 more at the age of 42. And she got pregnant with twins.
Of course she did.
It was a surprise.
Yeah, of course she did.
Yeah.
According to the U.S. Census, the median age of birth mothers in 1990 was 27. In 2019, it was 30. And as maternal age keeps going up, do you think the advanced maternal age, that moniker, is going to change?
Yes, I think that's going to continue to increase. And as I mentioned before, when I first started practicing obstetrics, it was 1 out of every 10 or 15 women that were above the age of 35. And now I'm seeing a lot more. It's more like 10 out of every 20. So we're seeing more and more women above the age of 35 starting to conceive and wanting to have a baby. So I see the consensus and the statistics definitely increasing and favoring advanced maternal age.
Do you think they'll keep the name advanced maternal age, or it might change again?
That's a hard question, because I think that name has become an established name by not only billion companies.
It's not as offensive.
Correct. It's not as offensive, and it's a usable name by a lot of major society guidelines, like the American College of OBGYN, the Society of Maternal Fetal Medicine. They use that term a lot in a lot of their guidelines. So I think that terminology may stay. But you never know. In 4, 5, 6 years, 10 years from now, that term may change again. Just like The old term now, the
Well,
geriatrics and
I mean, there's a
elderly.
big difference between advanced maternal age and elderly pregnancy. Like that is
Totally
a slap
agree.
in the face.
Totally agree.
You're already,
Totally agree.
especially when you go to your first elementary school meeting as an older mom, you're like, oh man, some
Yeah.
of these people are real young.
Yeah, I agree.
All right, here's another one. I had a friend who used IVF to get pregnant in her 40s. Insurance covered only part of the procedure if she used a donor egg. Is that common? And if so, at what age do you have to use donor eggs?
Yeah, that's a good question. So donor eggs can be used at any age. It doesn't matter how old you are. More people are more likely to use donor eggs the older they are because the quality of the egg gets worse. So when a lady at the age of 40 or 45 goes to see infertility specialists, they're more likely to counsel them on using a donor egg
That
to
makes
help
sense.
reduce some of those risks of wear and breakdown and the quality of the egg.
Okay.
In terms of insurance companies, it's variable. It depends on the type of insurance that they have. Some insurance companies may do that. However, if there's very good documentation in the chart, like the patient tried to get pregnant multiple times, has infertility, has some problem with their fallopian tubes, the more documentation the provider has, the more likely that the insurance is going to cover a good bit of that coverage. But IVF can be a very expensive process.
Oh, I've heard nightmares about it.
But the outcome of having a child is priceless.
Oh, and everybody who's gone through it and has had a successful pregnancy will tell you the same thing.
Correct.
You don't go
Correct.
through that unless you are ready for a baby.
Absolutely.
All right, last question. If I'm getting close to 35, but I'm not close to getting married or having kids, should I freeze my eggs, and at what age should I do that?
Yeah, I think freezing eggs again can happen at any age, but I think once they get closer to 40 or more, or if they have some underlying condition, for example, if they have cancer and they need to have like certain chemotherapy or radiation to protect the quality of their eggs, they might want to try to freeze some of their eggs or embryos to try to promote that, for future bearing and stuff. But if they know they're going to have their first child at the age of 40 or 45, and they feel pretty strong about that, then it's probably better for them to freeze some of those eggs earlier, like around 30, 35 years of age,
Right.
to help improve the quality and the success rate of that pregnancy.
That makes sense. Well, that's my last question. You did great.
Thank you so much. Thank you for having me. I
Of
appreciate
course,
it.
I really appreciate
Thank
your
you.
time.
My pleasure. Thank you.
I love that finally being older in a medical way has a benefit. If you got pregnant when you were older naturally and had an uncomplicated pregnancy, good news, you may live to be 100. Did not see that coming. Dr. Bassam Rimawi specializes in high-risk pregnancies, and you can find him at WakeMed.org. This episode has some great listener questions, and if you have a question for a future episode, I would love to share them. Go to WRALFM.com/SarahHasQuestions and leave a message. See you next time.